Welcome to Pigeon Healthy. Today we're going to talk about one of the most common and one of the most dangerous problems in pigeon keeping, respiratory infections. If you've kept pigeons for any length of time, you've dealt with this. You walk into the loft and immediately hear it. That sound, wheezing, clicking, rattling when birds breathe. You see nasal discharge, clear at first, then becoming cloudy or yellowish. You notice birds breathing with their beaks open or working hard to breathe with visible chest movements. You see birds sitting fluffed up, eyes half closed, clearly struggling. Respiratory infections are terrifying because they can escalate so quickly. A bird that seems fine in the morning can be in severe distress by evening. Young birds are especially vulnerable and can die within days without treatment. Even birds that survive often have permanent damage to their air sacs and lungs, reducing their performance and quality of life forever. When faced with respiratory problems, most pigeon keepers immediately reach for antibiotics. Tylosin, doxycycline, enrofloxacin, these are the common choices. And I'm not saying antibiotics are never needed. In severe bacterial respiratory infections, antibiotics can save lives. But here's the problem. Respiratory symptoms in pigeons are caused by many things. Bacteria, yes, but also viruses, fungi, environmental irritants, stress, and simple mucus buildup from damp conditions. Antibiotics only work against bacteria. They don't help with viruses, fungi, or irritants. And even when bacteria are involved, overuse of antibiotics creates resistant strains, disrupts beneficial bacteria in the bird's system, and weakens natural immunity. What if there was a natural approach that supports the respiratory system regardless of the cause? What if there was an herb that loosens mucus, soothes inflamed airways, has antimicrobial properties, and strengthens the lungs without the downsides of pharmaceutical drugs? It's called Mullen, and it's been used for centuries as a lung healer in traditional medicine across Europe, Asia, and North America. I've covered Mullen briefly in previous videos, but today I'm going to do a comprehensive deep dive. I'll explain exactly how Mullen works on the respiratory system, show you multiple ways to prepare and use it, give you precise dosages for different situations, tell you what results to expect and when, and explain when natural treatment is appropriate and when you need veterinary intervention. This is everything you need to know to use Mullen effectively and safely for respiratory health in your pigeons. Understanding respiratory infections in pigeons. Before we discuss the solution, let's understand the problem. The avian respiratory system is unique and complex. Unlike mammals, birds don't just have lungs. They have a system of air sacs that extend throughout the body, even into the hollow bones. When a pigeon breathes in, air flows through the trachea, through the lungs where some oxygen exchange occurs, and into the posterior air sacs. When breathing out, air from the posterior air sacs flows through the lungs again for more oxygen exchange, then into anterior air sacs, then out through the trachea. This system allows for continuous gas exchange and makes birds incredibly efficient breathers, which is necessary for the demands of flight. But this system also has a vulnerability. Infections that start in the upper respiratory tract, the sinuses, trachea, or bronchi, can easily spread into the air sacs throughout the body. Once infection reaches the air sacs, it becomes systemic and much more difficult to treat. Additionally, the air sacs have relatively poor blood supply, so immune cells and antibiotics don't reach them as easily as they reach the lungs. Respiratory infections in pigeons are caused by multiple pathogens. Bacterial causes include mycoplasma, which is extremely common and causes chronic respiratory disease, chlamydia psittacis, which causes psittacosis or ornithosis with severe respiratory symptoms, Cullei, which can cause respiratory infection, particularly in stressed or immunocompromised birds, or Ornithobacterium rhinotracheae, which causes respiratory distress and high mortality, and various other bacteria. Viral causes include paramyxovirus, which causes neurological signs but also respiratory symptoms, herpes virus, which can cause respiratory infection, especially in young birds, and various other viral pathogens. Fungal causes, primarily Aspergillus species, which cause aspergillosis, a serious fungal respiratory infection, are also common. Environmental causes include dust, ammonia from dirty lofts, mold spores, cold drafts, and high humidity. The challenge is that clinical signs, wheezing, discharge, labored breathing, look similar regardless of the cause. You can't tell by looking whether it's bacterial, viral, or environmental. This is why antibiotics are often used empirically, without confirmed diagnosis, which contributes to overuse. What makes Mullen special for respiratory health? Mullen, botanical name Verbascum thepsis, is a biennial plant that grows wild in temperate regions worldwide. In its first year, it produces a rosette of large, soft, fuzzy leaves close to the ground. In its second year, it sends up a tall flower stalk, often 1 to 2 meters high, covered in small yellow flowers. The leaves are what we use medicinally. They're covered in fine, soft hairs that give them a velvety texture, which is why mullein is sometimes called velvet plant. Mullein has been used in traditional medicine for respiratory conditions for at least 2,000 years. The ancient Greeks and Romans used it for lung problems. European herbalists used it throughout the Middle Ages. Native Americans used it for respiratory ailments. This extensive traditional use across diverse cultures strongly suggests real effectiveness. Modern research has begun to validate this traditional knowledge. Studies have identified multiple active compounds in mullein leaves and analyzed their effects on respiratory tissues. Let me break down exactly what mullein does and how it helps. Expectorant action. Mullein contains saponins, plant compounds that act as natural expectorant. An expectorant is a substance that helps thin and loosen mucus, making it easier to expel. In respiratory infections, one of the major problems is thick mucus that accumulates in the airway. This mucus blocks airflow, makes breathing difficult, and creates an environment where bacteria and fungi thrive. Mullein saponins help thin this mucus and stimulate the cilia, tiny hair-like structures that line the airways and move mucus up and out. This clears the airways and improves breathing. Mullein's mucilage content. Mullein leaves contain mucilage, a gel-like substance that coats and soothes irritated tissues. When mullein is consumed, the mucilage forms a protective layer over inflamed mucous membranes in the throat, trachea, and bronchi. This reduces irritation, eases discomfort, and creates a barrier that protects damaged tissues while they heal. Think of it as a natural bandage for the respiratory tract. Anti-inflammatory properties. Mullein contains flavonoids and other compounds with anti-inflammatory effects. Respiratory infections cause significant inflammation in the airways. The tissues swell, become red and irritated, and produce excess mucus. This inflammation narrows the airways and makes breathing difficult. Mullein's anti-inflammatory compounds reduce this swelling and irritation, opening the airways and easing breathing. Antimicrobial effects. Research has shown that mullein has mild to moderate antimicrobial activity against various bacteria and some fungi. It's not as strong as pharmaceutical antibiotics, but it does inhibit growth of certain respiratory pathogens. Importantly, mullein seems to work through multiple mechanisms, making it less likely that pathogens will develop resistance. This antimicrobial action helps control the infection while the body's immune system mounts its response. Antioxidant properties. Mullein contains antioxidants, including vitamin C and various polyphenol. These protect cells from oxidative damage caused by inflammation and infection, supporting tissue healing and recovery. Demulleins in action. Mullein soothes irritated tissues throughout the respiratory tract, reducing cough reflex and easing discomfort. All of these actions work together synergistically. Mullein doesn't just address symptoms, it supports the body's natural healing processes and helps resolve the underlying problem. How to prepare mullein for pigeons. There are several ways to prepare and administer mullein. The best method depends on the severity of symptoms in the specific situation. Method 1. Mullein leaf tea for drinking water. This is the most common method and works well for mild to moderate respiratory symptoms or for prevention during high-risk time. Preparation. Use dried mullein leaves. You can purchase these from herbal suppliers or harvest and dry your own from wild plants, making absolutely certain of correct identification. Measure out 1 to 2 tablespoons of dried mullein leaves per liter of water. If leaves are whole, you can crumble them slightly to increase surface area. Place the leaves in a glass or ceramic container, not metal, as this can react with some plant compounds. Pour 1 liter of boiling water over the leaves. Cover the container to trap volatile compounds. Let steep for 20 minutes. This extraction time is important. Shorter won't extract enough active compounds. Longer makes the tea too strong. After steeping, strain the tea very thoroughly. This is absolutely critical with mullein. Those fine hairs on the leaves can come off into the liquid, and if consumed, they're irritating to the throat and digestive tract. Use a very fine strainer, coffee filter, or multiple layers of cheesecloth. Strain at least twice to ensure all plant material and hairs are removed. The resulting tea should be clear, golden brown with a mild, slightly sweet, earthy taste and smell. Allow the tea to cool to room temperature before use. Never give hot liquid to burn. Dosage and administration. For prevention during damp weather or high-risk respiratory seasons, Add 100 milliliters of Mullen tea to 1 liter of fresh drinking water. Provide this 3 days per week. For mild respiratory symptoms, slight wheeze, minor discharge, but bird is still eating and active. Add 150 milliliters of Mullen tea to 1 liter of drinking water. Provide this continuously as the only water source for more significant symptoms, obvious breathing difficulty, discharge, lethargy. Use the full-strength tea. Add 200 milliliters of Mullen tea to 1 liter of water, or in severe cases, provide straight Mullen tea diluted only 50% with water. Use for 7 to 10 days. Replace the water daily. Mullen tea doesn't keep well once diluted. Bacteria can grow in standing water with organic material. Storage. Concentrated Mullen tea can be stored in the refrigerator in a glass container for up to 5 days. For longer storage, freeze in ice cube trays, then store frozen cubes in a sealed bag. Thaw as needed. Method 2. Direct oral administration. For birds that are very sick and not drinking well, or when you want to ensure a specific bird gets an adequate dose, you can give Mullen tea directly by mouth. Prepare the tea as described above, ensuring thorough straining. Draw up 1 to 2 milliliters of room temperature tea into a dropper or syringe without needle. Gently hold the bird, open the beak carefully, and place a few drops at a time on the back of the tongue. Allow the bird to swallow between drops. Never force liquid quickly, as this can cause aspiration into the lungs, which is extremely dangerous. Dosage. For adult pigeons, 350-500 drains. Give 1 to 2 milliliters of Mullen tea by mouth, twice daily for 5 to 7 days. For young birds weaned squabs to 6 months, give 0.51 milliliter twice daily. For very young squabs still with parents, it's better to treat the parents and let them pass some benefit through crop milk, rather than directly treating babies. Method 3. Steam inhalation. This is one of the most effective methods for respiratory issues, because it delivers the beneficial compounds directly to the airways. Preparation. Prepare a strong mullein infusion using 3 to 4 tablespoons of dried mullein leaves per liter of water. Pour boiling water over the leaves, in a heat-safe container. Let steep for 20 minutes. Don't strain for steam inhalation. The plant material can remain in the water. The water should be hot and steaming but not boiling. You want warm, moist steam, not scalding steam that could injure respiratory tissues. Administration. You need a small enclosed space where the bird can be exposed to the steam. Options include a pet carrier, a cardboard box with air holes, or a small cage. The space should be small enough that steam accumulates, but large enough that the bird isn't cramped or distressed. Place the container of hot mullein infusion in the space. Make sure it's stable and the bird cannot tip it or get burned. Place the bird in the partially cover the space to trap steam, but ensure adequate ventilation, so the bird gets fresh air mixed with the steam. Never seal a bird completely in steam with no air circulation. Allow the bird to breathe the steamy mullein-scented air for 5 to minutes. Watch the bird constantly. If the bird shows any distress, panting excessively, trying frantically to escape, appearing weak, remove immediately. Most birds tolerate steam therapy well and actually seem to find it soothing and helpful. Frequency. Perform steam inhalation once or twice daily for birds with respiratory congestion, mucus buildup, or difficulty breathing. Continue for 3 to 7 days depending on severity. Steam inhalation is particularly helpful for loosening thick mucus and opening airway. Safety. Never let the water be so hot it could burn the bird. Never seal the bird in with no fresh air. Always monitor constantly. If a bird is very weak or in severe respiratory distress, steam therapy might be too stressful. Consult a veterinarian. Method 4. Adding to feed. Some keepers add dried, finely powdered mullein leaves directly to feed. This is less common than tea or steam, but can provide ongoing support. Grind dried mullein leaves in a spice grinder or coffee grinder to a fine powder. Add approximately 1 teaspoon of mullein powder per kilogram of feed, and mix thoroughly. Feed this enhanced mix during respiratory illness or prevention during risky season. The effectiveness of this method is less certain than tea or steam, because the dose individual birds receive is variable and depends on how much they eat. Dosage guidelines by age, size, and condition. Prevention. No current symptoms. Use mullein tea in water at 100 ml per liter, 3 days per week during cold, damp weather, or times when respiratory issues are common in your area. Mild symptoms. Slight wheeze or discharge. Bird still eating and active. Mullein tea in water at 150 ml per liter, daily for 5 to 7 days, or 1 ml
direct oral twice daily for 5 to 7 days plus optional steam inhalation once daily. Moderate symptoms, obvious respiratory difficulty, discharge, reduced appetite, Mullen tea in water at 200 ml per liter, or 50% strength tea, daily for 7 to 10 days in 1 to 2 ml, direct oral twice daily for 7 to 10 days and steam inhalation, twice daily for 5 to 6. Severe symptoms, severe breathing difficulty, open beak breathing, very lethargic. This requires veterinary care immediately. Mullen can be used as supportive care, alongside veterinary treatment, but is not sufficient alone for life-threatening respiratory distress. Adjustments for different birds. For squabs and young birds under 6 months, use half the adult dose. For large breeds like giant runts, 600-800 dren, increase dose by approximately 50%. For small breeds or very small birds, reduce dose by approximately 1/3. For very old or frail birds, start with conservative doses and monitor response before increasing.
Expected results and timeline. It's important to have realistic expectations about what Mullen can and cannot do, and how quickly results appears. Day 1 to 2, you might notice the bird seems slightly more comfortable, or breathes a bit more easily, but don't expect the wheezing to disappear overnight. Day 3-4, the wheezing, clicking, or rattling should be reduced. Nasal discharge may actually increase temporarily as mucus is being expelled. This is a positive sign that the